Let's talk about terminology for the hand region. Because the hand moves around a lot, the standard terms from the anatomical position can be confusing. Instead of anterior, we will refer to palmar. Posterior will be dorsal. Lateral is better referred to as radial, and medial will be ulnar. The wrist comprises 8 carpal bones. The proximal row includes, from radial to ulnar, the scaphoid, lunate, triquetral, also called triquetrum or triangular, and the pisiform. The scaphoid and lunate articulate with the radius, while the triquetral is separated from the ulna by a disc. The pisiform is anchored on the palmar surface of the lunate. The distal row includes the trapezium, trapezoid, capitate, and hamate. As a group, the carpals form a concave shape facing the palmar direction. On the radial side, the scaphoid and trapezium have small tubercles. On the ulnar side, the hamate has a prominent projection called the hamulus, or hook of the hamate, and the pisiform projects upward from the lunate. Stretched across these 4 projections is a tough sheet of fibrous connective tissue, the flexor retinaculum, also called the transverse carpal ligament. The flexor retinaculum, bridging the concavity of the carpal bones, thereby forms the carpal tunnel. On the upper surface of the flexor retinaculum, ulnar side, we find the superficial palmaris brevis and the hypothenar muscle group to the little finger, or digiti minimi, or digit 5. On the radial side, we find the thenar muscle group to the thumb, or pollicis, or digit 1. These groups flex, abduct, and provide opposition for their respective digits. Several large muscles located in the forearm pass their tendons through the carpal tunnel. The flexor pollicis longus runs from the radius to the distal phalange of digit 1. The flexor digitorum profundus runs from the ulna to the distal phalanges of digits 2 through 5. Superficial to the profundus is the flexor digitorum superficialis, with attachments to the humerus, ulna, and radius, and running to the middle phalanges of digits 2 through 5. In addition to the expected flexion of the finger joints that they cross, all of these large muscles also contribute to wrist flexion. There are several small muscles deep in the hand among the metacarpals. Of concern to us are the lumbricals that run from the tendons of the flexor digitorum profundus to the extensor expansion or hood around the MP joints of digits 2 through 5. These are important in coordination of finger movements. The final and most critical occupant of the carpal tunnel is the median nerve. This nerve is derived from the brachial plexus, travels through the arm and the forearm before entering the carpal tunnel on its way to the hand. It innervates all of the muscles in the forearm except for the flexor carpi ulnaris and the ulnar half of the flexor digitorum profundus. As the median nerve exits the distal tunnel, it gives off a motor branch, the median recurrent, to the thenar muscles. It also provides motor branches to the 2 radial lumbricals, those going to digits 2 and 3. The median nerve terminates in 3 common digital branches located in the 3 gaps among the first 4 metacarpal bones. These then split into proper digital branches going to the sides of these digits. Note that only the radial side of digit 4 is included in this pattern. Most of this distribution is on the palmar side of the hand, with some dorsal distribution around the